high blood pressure is defined as blood pressure of greater than 140 over 90, 140 being the systolic and 90 being the diastolic. Here I would like to mention what normal blood pressure is. It should be 120 over 80 or less. So you find out that somewhere in between the 120 and the 140, we have a group of people we call pre-hypertension. That's the group that is within this bracket. When your age is greater than 65 years, you are at risk of high blood pressure. Being an African, which you cannot change, puts you at risk. Having a family history, an aunt of yours, your mom, your dad, grandma, grandpa has hypertension, you are at increased risk. Being obese or overweight, this is calculated using the BMI. So any BMI above 30 for being obese, and then if it's overweight, anywhere between 25 to 29.9 is overweight. So any BMI within this bracket puts you at an increased risk. Also, alcohol consumption, increased alcohol consumption. There's a normal amount of alcohol you should take in a day. If you go beyond, you are going to be put at increased risk. Smoking also puts you at an increased risk of high blood pressure. Sedentary life, sitting at one place all the time, having no exercise regime can put you at an increased risk, as well as high cholesterol level also puts you at an increased risk of high blood pressure. You can get a stroke, which is when there's shortage of blood to the brain or there's bleeding into the brain. This ends up with the patient not being able to move the limbs, the face twists, or memory kind of failure and all that can come about. You can also have a heart attack. You can also have blindness. You can start with blurred vision because the blood flows through the whole system. So when it's high, it affects all the organs. Your kidneys can fail. Kidney failure can be a cause. Your liver can also affect your liver as well. So these are some of the conditions that you can have when you have high blood pressure. Some of the things to do: if you smoke, you need to change your lifestyle. So you need to stop smoking. With smoking, we always don't say reduce, we say stop. Alcohol, reduce the quantity of alcohol you take. The normal requirement or the normal allowed regimen for alcohol is about 2 units a day. Anything above puts you at risk, so you need to reduce that. You need to also increase your intake of fruits and vegetables in your diet throughout the day. Exercise is a very key part of this. And when we say exercise, we are talking about moderate exercise, about 30 minutes a day for about 5 days in a week. Making about 150 minutes of exercise in a week is very important in reducing your blood pressure. Stress, so we say make sure you make time during the day to relax. And what we say is about 10 minutes relaxation is very important. When we are talking about relaxation, you are not thinking about anything to do with work, family, anything, but you are just relaxing and then rewinding. So these are some of the ways in which you can. Reducing the salt in your diet can also help to reduce your risk of getting high blood pressure.